What did your constituents tell you into the lead up of what was supposed to be a vote today?
Well, thanks for having me, Mark. My constituents overwhelmingly told me to push back and fight back against this bill, and obviously to vote against it. I think the count in our office was something like 1,500 to 2,000 people called in to say, don't vote for this bill, and we only had about 20 people who were supporting it. So it was overwhelming against this bill. So I'm obviously very happy that it didn't pass today, and we didn't even have a vote on it.
Congressman, it's Margaret Talev. Thanks for joining us. Hi.
Sure.
So this is certainly a political victory for Democrats today, but are you concerned about this next step, which is the president saying that not only is he going to let Obamacare implode, but suggesting that he's going to help it along? What is it that the Democrats can actually do about this, if anything? And do you think that there will be real implications, or essentially do you think that what President Trump is saying is overblown and everything's going to be fine?
Well, listen, I think it's overblown. I mean, I think it was a talking point that the Affordable Care Act or Obamacare is blowing up, but it's not actually backed up by the facts. The problems with Obamacare have been centered on the individual market, which is only about 6% of all Americans that have health insurance. If you look at all the people insured in through corporate plans, through Medicare, through Medicaid, the individual marketplace, which are having problems, is only about 6% of the coverage. And the Affordable Care Act is doing a lot of very positive things right now. It's keeping health care costs down. It's expanded Medicaid. It's protected pre-existing conditions. So I think it would be terrific if what we were to do at this point were to work on a bipartisan basis to fix the problems with the Affordable Care Act. That's what I've been saying we should be doing. I think a lot of people feel the same way. And I think that's what the country wants us to do, which is to actually get down and do our work and take a look at the current healthcare marketplace, which is informed, obviously, by the Affordable Care Act, and focus on the things that needs to be fixed. So I hope the president doesn't do things to undermine the Affordable Care Act and purposely make it perform worse, because I actually think it's working really well, and there's a bunch of things we can do together on a bipartisan basis, working with the administration and the other side of the aisle to make it better.
So, Congressman, let me see if I get your point right, that you acknowledge, and some Democrats acknowledge, that the Affordable Care Law is not perfect, but scrapping the whole plan and trying to start over would lead to what?
So I think, first of all, I think this plan that they were proposing was a very bad plan. It would take away, according to CBO, health care from 24 million Americans. I think it was, if you looked at the amendments they were proposing today, they were rolling back kind of the minimum standard in health insurance plans. So I think what they were going to do today would have really hurt the country and hurt the progress we've made in health care. Of course, the Affordable Care Act is not perfect. The Affordable Care Act intention was to reform the U.S. healthcare market, which is 1/6 of the U.S. economy. If it was its own country, it'd be one of the largest countries in the world. What we should have done is pass that law and committed ourselves for 10 years of fixes, because that's what this law needs. It needs us to come together and work together on the problems with it. And the problems, as I said, are centered on the individual market, which is not really working. And the reason it's not working is because there's not enough young people in the pools, and because the insurance companies right now can't fully transfer the risk to the people who are in the pool. So it's kind of out of balance, if you will, the individual marketplace, and that's where we need to focus. We don't need to roll back Medicaid expansion. We don't need to roll back the minimum standards. We don't need to roll back all the incentives that exist for how hospitals are paid, to encourage them not to have readmissions, et cetera. We don't need to roll back all of those things. We need to focus on the part of the law that's not working.
Okay.